Assalamualaikum warahmatullahi wabarakatuh. Now, we want to present our PPT about handling aggressive or irritable patient in pharmacy practice with Group 2 with the member Artika Eka Putri and Sofia Azahara. For the first, we want to explain for the introduction and the background. So, patient interaction is a fundamental component of pharmacy practice, particularly in community and hospital settings. Pharmacists are not only responsible for dispensing medication but also for ensuring effective communication and patient understanding. However, in real world practice, pharmacists frequently encounter patients who exhibit aggressive or irritable behaviors. These behaviors can disturb communication, increase the risk of medication errors, and negatively affect healthcare outcomes. Therefore, the ability to manage such patient is an essential professional competency. Next is for the definition of aggressive and irritabilis. Aggressive patient is defined as individual who display verbal or physical hostility, including shouting, threatening, or confrontational behavior. And for the irritable, it is patient that refers to someone who is easily annoyed, impatient, and emotionally reactive, often due to discomfort or dissatisfaction. Therefore, the ability to manage such patients is an essential professional competency. Next is for the cause and contributing factors. The aggressive or irritable behaviors in patients may arise from multiple factors. That is, first, physical factors like pain, chronic illness, and fatigue. And the second factors is psychological factors. That is anxiety, depression, emotional distress. And the third factors is the situational factors. That is long waiting time, miscommunication or misunderstanding, and financial concerns. For the fourth factors, that is medication related factors. For the example is side effect affecting mood or cognition. The understanding these causes allows pharmacists to respond appropriately and empathically. Next, for the drug-induced behavior changes. The example of the drug that induces behavior changes is salbutamol. The salbutamol may cause restlessness and nervousness. And the next one is prednisone or corticosteroid group. It associated with mood swings and irritability. Next is caffeine containing products. It can increase anxiety and agitation. And the last example is benzodiazepine withdrawal. For the example like diazepam, may cause a rebound anxiety and irritability. For the next explanation, will explain by Sofia Azahara.
Okay, for the role of the pharmacy play a critical role in the managing challenging patient behavior by the first is deliver patient-centered care. The second is ensuring safe and rational use of the medication. And three is identifying drug-related problem. And the fourth is providing clear and empathetic communication. And the last is maintaining professionalism under pressure. And for the communication style for the layer model, is the L is the listen. Listen is activity listen, which the interpreted, and A is the explain. Explain is the provide clear and understandable information, and A is the acknowledge well, is the validated the patient's the feeling, and R is the recommend, is override appropriate solution, and the last is N is the negotiates, is there is a mutually acceptable plan, and this approach promotes mutual understanding and reduces conflict. And next is the de-escalation technique. To manage a crisis situation, pharmacy should apply the hesitation strategy. The first is maintain a calm and composite demeanor, and the second use a soft and respectful tone of the voice, and the three avoid argument or become defensive, and the four acknowledgement emotional is an understand for your protection and the less over ever practical solution. Test the technique help the prevent acceleration into unsafe situation. And for the safety and ethical consideration, we have the two. The first is safety make sure is like maintain and safety physical distance. Be aware of the if environmental risk and the less seek assistance if necessary. And the second is ethical principle. The first is principle patient digitally, and the second is maintain confidentiality, and the three profits equitable care without discrimination. And for our conclusion, aggressive and irritable patients are common challenges in the pharmacy practice. Their behavior is often influenced by psychological, situational, or medical-related factors. Pharmacy must utilize strong communication skill, empathy, and professional judgment to effectively manage the situation. Ultimately, proper handling of serious patient contributes to the improved patient satisfaction, medication safety, and overall healthcare quality. And this for our reference. Thank you for your watching, and let's live the healthy, guys.
Oke, udah.
Okay.